Most healthcare today requires the pooling of risk. We have car insurance. Wouldn't it be nice if we didn't have to pay car insurance or house insurance on our homes? You know, every year you get these bills. You know, just, you know, if your house burns down, build another one, write a check for it, you know? Well, no, we pool our risks. We put together healthy people and sick people and old people and young people, liberals, Democrats, Republicans, conservatives, all of the pluribus unum people. We put them all together in a group and they all contribute some money. And then when one of them gets sick, we take out of that pool to pay for it. You know, if we don't have that, then we all become predators. We're all out there, and the ones who have a checkbook and a credit card can go in and get their health care, and they'll say, yeah, give me a couple of MRIs at least, you know, what the heck, because I can afford it. And the ones who can't afford it are not going to get health care. And it seems to me a lot of people don't understand that. So complexity is a really big problem. This is by a neuroscientist, by the way, who paints, and all of his paintings are about complexity. And I guess I thought I would use, with his permission, that particular picture because that's a big problem. 60% of US firms offer health benefits to any of their workers. And I say only 60% because the rest then have to be cared for in other ways. And you know that premiums are going up and they're at $13,375 a year, except the rates are going up very quickly, much more quickly. This is the new Kaiser Family Foundation report that you probably have seen, or you can Google it on the internet. Healthcare is up 131%, wages 38%, and inflation 28%. So costs are rising very quickly. Problems with having employer-based insurance is discrimination against older workers. You know about this company where one employer hired a person who was 40 years of age, and they immediately raised the rates because it was an older person. 40 years, I wish I was 40. I don't think that's old age. It's discouraging firms from offering healthcare insurance, and it forces employers to think twice about hiring new workers. So it's not very good, and deductibles are going up at small firms from 3 to 199 workers. 40% of them face deductibles of $1,000 or other basically rising expenses. And this is a chart that you've probably all seen going up to 2020. I couldn't find one for 2050. We just can't project that far. But you know, it's too unstable an environment. You can see it begins with 1999, 11% of the median family, and then it keeps going up until 2020. It's almost up to 25%. At 25% of families' income for insurance premiums. So that is troublesome. We know that Medicare is a problem, and the millions of seniors who signed up for private health care plans through Medicare are now facing extremely high increases in premiums, and the Medicare population, of course, well, some of us, I see some other folks my age and a little bit older, and those of you who are the baby boomers, 70 million in 2025, rising from 40 to 70 million. How are we going to manage Medicare when everybody is eligible? Well, almost a third of Americans are eligible, and that is a real problem. Low-income elderly women in poor health now spend about 52% of their income for out-of-pocket health care, and imagine it's going to go up to 72% by 2020. Well, you can't spend 72% out of pocket for something. What are you going to do for rent and other things? So really serious problems. Not going to talk too much about the Commonwealth Fund report, but it's a very good one. It says we need to cover the uninsured, enhance affordability of insurance coverage, and control the rise of healthcare costs, which is not much of an issue, but achieving the first goal without the second and third, you can't do that. You have to cover the uninsured. We have to have something like that. And we have to slow insurance costs as well. If you get a chance, talk to Jack Hatch. Good guy. Don't agree with everything he does. One of my students, of course. And Jack, I have a little interview here which I won't play. You can go see it at insideriowa.com. I left some cards up on that table. I don't know if you all got those or not, but it's a new internet magazine that I started with Stan Brewer. And the interview with Jack Hatch is there, so you can go watch it there. It's a little digital video. But we are talking about healthcare insurance in the U.S. We should have talked about healthcare reform long ago. Actually, we did. Yeah, we did. This chart is Nixon, Carter, and Clinton. If Nixon had been able to put together with Ted Kennedy a healthcare reform of some sort, the rise in the cost of healthcare as a percentage of the economy would have only been that purple line. That's the Nixon line, because it would have fixed some things that drove up prices. You see 10.7% there. Well, it didn't happen, all right? What if Jimmy Carter had managed to get some healthcare reform? Well, then it would have slowed down and flattened out to 11.5%. Well, it didn't happen. Well, what if Clinton had managed with Congress to put through some sensible healthcare? Well, it didn't happen. So it went up to 14.2%. Well, what if Bush or Obama were able to get it through? Well, it's getting late. It's getting late. Because we have dug ourselves into a hole. We want to avoid healthcare reform. We try, but it's so political, we can't get it done. And if we can't get it done this time, that curve of costs there, as you can see, is going to keep going up, and the expenses are going to keep rising. So the federal government would have been a big beneficiary if we had gotten regular healthcare reform, normally done, sensible, good stuff, and instead of consuming 6.2% of the GDP in 2010, federal outlays would have been about 3.7%. And Nixon's reforms would have helped, and others as well. Rises of